Greetings, everyone. Welcome to the webinar, Food Justice and Junk Food. Will more supermarkets equal more access to healthy food in underserved communities? This webinar is offered by the Institute for Agriculture and Trade Policy, or IATP. I'm LaDonna Redmond, Senior Program Associate with IATP's Food and Justice Program, and I'll be moderating today's webinar. The Food and Justice Program, together with IATP's Healthy Food Action Initiative, organized this particular webinar. Healthy Food Action is IATP's nationwide effort to engage health professionals in food and agriculture policy issues critical to creating a healthier food system. Today, we have the pleasure of being joined by Dr. Jan Boone-Heinonen, who will be discussing her recent study titled Neighborhood Fast Food Restaurants and Fast Food Consumption, a National Study. We will be taking questions from the audience today after our speaker has finished her presentation. You can submit your questions to us at any time during the webinar by using the question panel on your screen. Just type in your question and hit send. We will review questions as they come in, and the panelists will respond to as many questions as time allows. I now would like to introduce you to our speaker. Dr. Jan Boone-Heinonen is an associate professor in the epidemiology division of the Department of Public Health and Preventive Medicine at Oregon Health and Science University. She conducted the present study at the University of North Carolina at Chapel Hill, where she completed her PhD in nutrition epidemiology and interdisciplinary obesity training postdoctoral fellowship. Her research interests include individual and environmental determinants of obesity-related behavior, with special interest in influences of the built and social environments on physical activity, diet, and obesity, and in methodological approaches for addressing issues of causal influence in estimating impacts of policy and environmental approaches on health. Welcome, Jan. The screen is all yours to begin your presentation.
Okay. Thank you all for joining us today, and I would like to thank LaDonna Richmond and others at IATP for the invitation to participate. This is really providing a much-needed forum for joining researchers with policy and community leaders to talk about how we can really work together to promote better access to healthy food for all community members. So I'm really looking forward to our discussion today. So we're all here today because we want to understand if more supermarkets equal more access to healthy food in underserved communities. I'd actually like to modify this a little to say whether they equal better diets in underserved communities. So I'd like to start with a framework that we can use to think about this question. First, there are several types of food resources that have received attention, and I'll just talk about these three here. Fast food restaurants, of course, are thought to promote consumption of high-fat, convenient foods that we generally think of as fast food. Shown here are burgers. We also think of fries, sodas, and so on. Supermarkets are of major focus primarily because they're thought to provide affordable fresh produce, thus promoting consumption of fruits and vegetables. And the conceptualization of smaller grocery stores is actually quite mixed. Sometimes they're seen as a source of healthy foods, especially in urban areas. Other times they're seen as less affordable alternatives to supermarkets. So we have very clear hypotheses about how fast food restaurants and supermarkets might impact diets, but our hypotheses were less clear about smaller grocery stores. So these diet behaviors have in turn been shown to be related to body weight, either lower or higher risk of obesity. And this is why they've been so important in obesity prevention policies. Some of the limitations of the field include the fact that many studies really don't have detailed diet data. Diet is complex and expensive to collect, particularly in a detailed way. So many studies have height and weight for calculating body mass index and obesity. So there are many studies that examine how these types of food resources directly relate to body weight. But this approach assumes that diet behaviors underlie such relationships. And second, while there have been numerous studies that have shown, for example, that greater availability of supermarkets is related to lower obesity or greater consumption of fruits and vegetables, virtually all studies have been conducted in cross-sectional settings. So in other words, the food environment and the health measures are measured at the same time. So the limitation of this problem is that aside from impacts of food resources on diet, two alternative explanations can underlie these relationships. So that you see the arrows going in the reverse direction here. First, fast food restaurants and food stores, they strategically locate themselves in areas where they predict the greatest profits. Another mechanism may be that people with certain types of health behaviors, including diet and so on, may locate in different types of neighborhoods. And this could be due to affordability, practicality for those with families, so that would be a suburban or urban type of decision, proximity to work, or simply preferences to live close to certain types of resources, or preferences to not live close to certain resources. For example, wealthy neighborhoods rarely have supermarkets. They're usually located far away. So these alternative explanations really can't be teased apart by cross-sectional studies. So today I will discuss findings from our study conducted by my colleagues at UNC Chapel Hill and I to help understand these issues. I'll spend about 30 minutes on the presentation, but then I'll leave the remainder of the time for discussion because I think it's really important to get your thoughts and share our ideas. Okay, so we wanted to focus on a few key questions. The first is, excuse me, we examined a large study population with both detailed diet data, which I mentioned is rare, linked to very detailed neighborhood environment data. And we asked the question, what types of resources are most strongly related to diet behaviors? While supermarkets, smaller grocery stores, and fast food restaurants have been targeted by policies, we wanted to understand which approach showed the greatest promise. Second, we wanted to better understand what we mean by neighborhood resources. For a moment, think about how far would you travel for fast food or for your groceries, and how that answer might differ in higher versus low-income populations and men versus women. These issues are unclear, but they're really important for understanding how to create effective policies. And third, we wanted to understand whether relationships between these specific types of resources and diet behaviors hold when we follow the same people over time. So again, this is in contrast to the cross-sectional studies that make up the large proportion of evidence to date. So I would like to emphasize that our study is just one approach to address these questions. We examine these issues in a large group of people residing from each region of the country who are then followed for 15 years. And to do this, we use data from the coronary artery risk in young adult study, or this is also called the CARDIA study. It was a sample of black and white young adults. It was sampled to achieve a good distribution according to age, sex, race, as well as education. And subjects were recruited from Birmingham, Alabama, Chicago, Illinois, Minneapolis, Minnesota, and Oakland, California. Since baseline, we followed over 15 years. They have distributed themselves throughout the entire country. So our sample actually includes all areas of the country. The study began in 1985 and 1986 when these participants were 18 to 35 years old. They were young adults, and there were just over 5,000 of them. They were followed up after 7 years, 10 years, and finally in 15 years when they were primarily middle-aged adults. Penny Gordon-Larson, who wanted to participate in this webinar but had other commitments, she built a geographic information system which linked a very wide range of neighborhood environment data to the home locations of the participants in the CARDIA study. Our neighborhood environment data included a wide variety of food stores, restaurants, census data, including neighborhood poverty, as well as a really wide range of other neighborhood characteristics. A unique aspect of our data is that it's temporally matched. So what this means is that historical data were used so that neighborhood environment measures for year 0, for example, reflect the respondent's neighborhood environment in 1985 to 1986. So in this way, we captured not only changes in the environment that results from people moving from one neighborhood to another, but also changes in the environment around people who remained in the same neighborhood. And this is a unique aspect of this study. So which food resources and diet behaviors did we examine? First, we examined food resources within each of these concentric areas. For example, resources within 1 kilometer in this middle circle of a person's home, within 1 to 3 kilometers, and so on. We took this approach to better understand how close resources might need to be to impact behavior, and furthermore, whether this differs by income or sex. We examined 3 types of neighborhood food resources: fast food restaurants, supermarkets, and smaller grocery stores. We calculated these resources as availability, or the number of resources per 10,000, or in the case of supermarkets, because they were less common, per 100,000 population. This approach helps to correct not only for the demand of each resource, but, or thought of another way, the fact that by nature there are more resources in areas with more people. We focused on the most theoretically direct relationships specifically how fast food restaurant availability is related to fast food consumption. This is weekly consumption per week. And supermarket availability in relation to diet quality, and then the same diet behavior in relation to smaller grocery stores. We measure diet quality using a diet quality index that summarizes 10 components of the 2005 dietary recommendations for Americans. And these included components such as total fat as a percent of total calories, added sugars, servings of reduced fat milk or milk alternatives. So given the issues that I discussed around where people and businesses decide to locate, first I want to talk about what neighborhood and individual characteristics did we actually address in our analysis. So first, by adjusting for a series of characteristics, we estimated the effect of the food environment independent of these variables: income, smoking status, marital status, and children, as well as neighborhood poverty. And we analyzed these data separately in men and women. And smoking status shouldn't be there. We didn't control for smoking status. Second, we used the best analytic tools available to examine our longitudinal data. We were able to capture changes in each individual's environments over time, as well as corresponding changes in their diet behaviors. So you can kind of think about this as we use each person as their own control. And if you're wondering where race is, whether we accounted for race, characteristics that do not change over time are adjusted implicitly in our analytic technique. And then thirdly, we tested if relationships were different across income groups. So what did we find? With regard to our fast food analysis, we found that greater availability of fast food restaurants was related to greater consumption of fast food among low-income men. So shown here is the percent increase in weekly frequency of eating fast food with a 1% increase in fast food availability. And this is shown for low-income men. For example, for each 1% increase in fast food availability within 1 to 3 kilometers of homes, we found a 0.34% increase in frequency of fast food consumption. This relationship was not apparent in areas farther from homes, nor were they apparent in medium or high-income men. So what this suggests is that low-income men may be particularly sensitive to inexpensive, convenient foods close to their homes, perhaps because they have less access to transportation. In women, our fast food findings were less clear. This is a similar graph for low-income women. It shows greater fast food consumption with greater fast food availability in areas farther from homes, but the opposite relationship within areas closer to homes. But none of these findings were statistically significant. So there are, in essence, no difference from no association. In high-income women, we see a much different pattern. We see the opposite of what we expect, that lower fast food consumption is related to greater availability of fast food. So these are confusing results, and while we can't explain for certain what underlies these relationships, these findings really suggest that key drivers of diet decisions may vastly vary across subgroups. So in other words, just imagine the differences in the barriers and drivers in making dietary choices in low versus high income women. Resources to purchase foods from different, more healthful restaurants vary according to these groups. Perhaps the time to prepare meals at home, among many other factors. So these are just hypotheses, but are somewhat mixed findings, really suggest that we need to dig deeper into why these relationships look the way we do. So this next slide presents our supermarket findings, first for men. Along this first column is the concentric area within which supermarket availability was measured. So these are the same areas within 1 kilometer, within 1 and 3 kilometers, and so on. The second column shows the change in diet quality predicted, again, from a 1% change in supermarket availability. For example, a 1% change, 1% increase in supermarket availability within 1 kilometer, on this cell here, from homes was related to a 0.1 unit reduction in diet quality. So it's important to note that our diet quality index has a 0 to 100 scale, with higher scores indicating higher diet quality. So a 0.1 difference is a very small change, and indeed none of these results were statistically significant. In the third column, we show the odds ratio, or the relative odds, of meeting fruit and vegetable recommendations. For example, again, we're looking at a 1% increase in supermarket availability. And if we look at within 1 kilometer from homes, was related to a 1% increase in odds of meeting fruit and vegetable recommendations. So these were generally weak associations, with the exception of this 2.1 odds ratio for the area within 1 to 3 kilometers of homes. And findings were quite similar in women, generally weak and non-significant findings. So to summarize our major findings, we found a strong relationship between greater availability of fast food restaurants and greater consumption of fast food, but only among low-income men. Our food store findings suggest that we may need multiple types of strategies to accompany environmental changes. So what do I mean by this? It may not be enough to simply introduce a supermarket or grocery store. We need to accompany this new store with other approaches, such as targeted promotion, education, and perhaps incentives for healthier options. And what our findings tell us is that we need to look at many ways of changing diet behaviors. So diet behaviors clearly need to be improved. Obesity clearly needs to be addressed, and having access to healthy foods is clearly critical, but it does not appear to be sufficient. Rather, it's probably one critical ingredient in promoting healthier diets. And lastly, our study improves on past studies by using national longitudinal data, but we really need a lot more work to understand the nuances of how neighborhood environments impact behavior, and I'll talk about that here. What are the major gaps in our understanding? What are these nuances that we need to better understand? And this is where groups such as this can really make an impact on research and policy. So first, as a field, we don't know a lot about specific characteristics of restaurants and food stores. We use these broad categorizations, such as fast food restaurants and supermarkets, with the implicit assumption that all fast food restaurants are equivalent. I think we know the answer to these questions, that indeed all supermarkets and all grocery stores and all fast food restaurants are not equivalent. And importantly, there are some major temporal changes in which, again, just for example, in which traditional fast food restaurants are offering healthier options. Alternative fast food restaurants offer exclusively healthy options, such as we have one down the street that has brown rice bowls with tofu and your choice of vegetable. So, fast food in itself is not unhealthy. It's the typical foods that are sold in fast food restaurants. Small food stores and even convenience stores are starting to carry fresh produce. So we really need to think about, are we interested in access to specific types of resources or specific types of foods? And I think we'll probably agree that we're interested in the latter. Other aspects that this study does not capture, as well as the vast majority of the field does not capture, includes affordability and quality. Social aspects, particularly in segregated neighborhoods, there are race issues and conflicts. Smaller stores have the advantage of already serving and having relationships within their communities. And the trend towards supporting these small stores is a promising one, but should be carefully evaluated to demonstrate their value and also inform future improvements. And this is one example shown here. This is a traditional convenience store, and this is an example from Portland. It's a newly opened village market that sells exclusively healthy foods, and it's located in a low-income area. Two terms are particularly descriptive. I wish that I could attribute these to a source, but I just heard this food mirage term, which I think is so descriptive, but I don't know what the source is. So if somebody knows, please let me know. But the idea here is that you might have, particularly in gentrified areas, you might have a really fabulous supermarket, but it's unaffordable to the low-income households that live there. And so in studies such as this, we're not distinguishing between a supermarket or a grocery store that's affordable versus not affordable, and those that carry healthy versus unhealthy options. A few other gaps is that we really know very little about how food resources beyond a residential neighborhood impact diet. Much fast food may be eaten during the workday or between home, school, and work. Food shopping may also occur in the same way. And lastly, I don't know of any studies that assess access on public transportation. We assume that driving along the most direct route is how people access that store. But I don't have to tell any of this group that not everyone has access to a car and that the bus takes longer than driving. So I'll wrap up with this final framework to really emphasize how complex relationships between neighborhood resources and diet are, and how far we have to go to really understand them. So our study, as well as most others, examined the relationship shown here. we look at proximity to a supermarket, and which, as I just mentioned, a pretty gross indicator for ease of travel, and how it relates to food consumption. But really consider all of the steps in between. So, a mother might arrive at a supermarket. She walks in and locates food items that she's looking for and some items that she was not looking for. She selects and purchases some food items, and these food items are then brought home and prepared or not prepared and then thrown away. And then prepared foods are then eaten or not eaten. And surely we can all relate to each one of these steps in our own household, as well as the groups that we work with in the community. So here are just some environmental and individual factors that might influence each one of these steps. This is not a comprehensive list. These are just some examples. So to start with availability, so we talked about proximity. When we're finding food items in a food store, whether that food store carries the item we're looking for, in-store marketing and food placement may play a major role. When we think about supermarkets and the affordable fresh produce offered there, we can't forget the vast array of unhealthy foods that are also available. And these unhealthy foods are often the first thing you see upon walking into the store. So there's a vast marketing literature on product placement and these types of issues that are starting to bleed into the health literature, but need to get better integrated into these sort of more environmental macro impacts on health. Affordability and quality. Clearly, there's a balance between preferences and budgets. And then finally, in terms of preparation, having other neighborhood food options might influence whether dinner gets prepared or whether the family goes out to eat, especially among busy families. But there's not a lot of work done around in this area. Individual factors, transportation, time constraints, preferences, skills in food preparation. These are all factors that might play a role in one or in all of these steps. So I'll leave you with this, and that's all I have to say. We can move on to the discussion.
Good. Okay. Dan, thank you so much for your presentation. We have a lot of questions for you, and I just wanted to say before we got started that one of the biggest reasons for my interest in having this particular webinar was because of the findings of the research. And as an activist and totally as a community person working to increase food access in urban communities, one of the strategies that we really thought would work would be supermarkets. But of course we realized, I think, that supermarkets in isolation would not necessarily solve the many issues that communities face in terms of food access. So this question of food justice or junk food is really a very important question, because we really are, I think we really are talking about the issue of justice. So I don't want to spend too much time just kind of gabbing away, because I got a lot of questions here. And I'll start off with this one. How do you define smaller grocery stores in the study, Jan?
That's a great question. We use standard industrial codes, and it's based on square footage, number of registers, and the cutoffs I do not have off the top of my head, but supermarkets are things like a Safeway or an Albertsons or a Kroger's, and a grocery store are smaller. They're typically, less than 2 or 3 registers. They offer a broad range of foods, but not the full selection that you'd find in the supermarket. So a Trader Joe's would be an example of a grocery store. And then, of course, the smaller grocery stores that you find in cities would be probably more typical in urban areas.
Thank you. Where has your study been published? I know I first saw the study in the AMA. Wasn't it published there?
It was published in the Archives of Internal Medicine, yeah, okay, which is a journal associated with the American Medical Association.
All right.
Okay. Yeah, and the reference is on my first slide if those get distributed.
Okay. Another question here. Why was there a decision to not include farmers markets in the study, and if so, why?
That's a really great question. Farmers markets are, well, I'll start out with sort of the scope of the study. So this was a historical study, so we needed to understand, we needed to be able to measure neighborhood resources back to 1985 and 1986, and there's just not that kind of historical record available for farmers market. It's also national. And so, a national database of farmers markets is also not available, not even today, at least that I know of. But I mean, that's, I think longitudinal national studies provide one picture of what we need to look at, and then, more local focus studies can capture things like farmers markets and community gardens and CSAs, and a lot of those alternative types of outlets.
Okay. Here's another question. Someone missed the food swamps. Was that the same as food mirage? And can you go over that a little bit more?
Oh, I did. Yeah, I didn't define that. I'm sorry. So food swamps is the idea that it's not just what's not there. So we think of food deserts being the absence of healthy foods, but there's also food swamps incorporating things like what we think of as fast food. So it's the presence of a wide variety of unhealthy foods.
Okay. And the food mirage
would be
I sort of think of the whole almost as a food mirage, though. I mean, I'm sorry.
Yeah. Well, you could argue that the way that we typically measure and identify food deserts, or I guess the absence of food deserts, many of those are probably food mirages. So it's an affordability issue, and it's also a broader access issue. So it could be a neighborhood maybe with a really wide variety of, fabulous fresh produce, but if it's offered at Whole Foods, it's just not a valuable resource for low-income folks. So it's a mirage in the sense that it looks like there's access to healthy foods, but it's only for a certain subgroup.
Mm-hmm. That's important. Yesterday, well, actually Sunday, Mark Bittman's column, the New York Times columnist, had a very interesting column, and he indicated that in his column that junk food isn't necessarily cheaper than home-cooked meals, yet not everyone's comfortable with cooking. What do you think the implications of the lack of knowledge on how to cook are in terms of this question of diet?
Well, I'll start out by saying this is a purely I don't have a research background in this, but I think cooking skills are definitely lacking, but I think it's also time constraints. There's, especially busy families, dual working parents. There's just not a lot of time, and it takes a lot. It takes a lot of time and skill to prepare a good tasting, healthy meal in a short period of time on a limited budget. And so I think you're sort of seeing all of these kind of barriers piling up for certain groups of people, and it just, I think, becomes insurmountable at some point, or very difficult to overcome. So I think it's, like I said, there's cooking skill, there's making it taste good in a short period of time on a limited budget. So those are 4 things that people are facing. And I'm sure there's many others as well. So there is some body of knowledge about this, but it's definitely not understood well enough to really say with certainty how these things impact diet and health.
Okay. Here's another question around the findings for income, and the question is written this way. Why did you show findings by income for fast food but not for supermarket access? Didn't your study find that there was an effect for low-income men living close to stores and for low-income women, though not statistically significant for low-income women?
So we tested for differences by income for all 3 of the resources, so fast food restaurants, supermarkets, and smaller grocery stores. And those interactions were significant in our fast food and our grocery store analysis, but not in the supermarkets. And so that's why it's not displayed that way. And we did run those results according to income for supermarket to diet quality. And it looked essentially the same. Most of them were, very small, not significant associations.
Mm-hmm. I don't know if this is quite the same question, but maybe a different aspect of it. Do you think that the reason low-income women rates for fast food is higher further from home because she is picking it up on the way home from work for the family?
I'm sorry, can you, high-income women you said?
Low-income women. Because she's further away from home and picking up
That's
the food.
Possible.
Mm-hmm.
Yeah, that's possible. I mean, like I could say that, that it's a major limitation that we don't have information on their workplace location and how far they're traveling, and that there's probably systematic differences in travel distance for low and high income groups as well. And so that's a major hole. That's certainly a possibility.
Your study also indicated a link, I think, between this issue of food access and transportation. Can you say a little bit more about the study and how it found some relationship between the two?
We didn't explicitly find the relationship. So we had hypothesized that low-income groups would be more sensitive to their neighborhoods within a smaller distance from their homes for that exact reason, because they may be more constrained in terms of their transportation options. But we didn't have information on how they traveled, between home and work, between home and school, between home and a restaurant or a store. So it was sort of the driver of why we looked at income and within these different concentric areas around people's homes. But we can't say with certainty that that's the reason that the results look the way they do.
Okay. Thank you. In your opinion, what are some of the most reliable observational tools to measure the food environment, such as the Nutrition Environment Measures Store Survey or a Market Basket Survey? Are there others that you suggest could be used to measure the quality, affordability, and cultural appropriateness of food availability in stores? It's a great question.
Yeah, I think, yeah, that is a great question. I'm actually relatively new to the sort of the direct measurement of food environments. What I do know is that the NEMS tool, so the Neighborhood Environment Measurement Survey, and they have that for restaurants and stores, is an excellent tool. It's very commonly used. It's one of the few that has reliability testing done on it. It's also adaptable to be relevant to different communities. So, one limitation of the tool as it's sort of the baseline tool is that it does miss a lot of ethnic-specific foods. But it's, the creators of that tool are very open to adapting it to include, Hispanic or Indian or Asian or, whatever, kinds of groups that they're interested in. So that's definitely a promising tool. That said, and this is a really new area, and there's a lot of work to be done. And so there's a lot of tools being published all of the time, and the challenge will be to kind of combine the best of the best and make sure that it's relevant and meaningful.
Wonderful. Okay, let's see. In this study, did you get a chance to look at differences by race? I know you mentioned earlier some distinctions by race, but there's one of our webinar attendees is asking for more information.
That is also an excellent question. We did not look at race. It's certainly an important next step. The way that we cut the income categories, it was driven with this in mind. So we made sure that there was enough overlap among blacks and whites in each income category to be able to look at that as a next step. But it's a really important issue that needs to be asked.
The question here around what the next steps are, actually, and how do you see these kinds of studies and solutions helping to change the context for a national effort. For example, a local government may not be able to effectively regulate marketing of soda, while federal regulations could address soda in schools. So I think the question is, where do you see work like this going, and what kind of impact do you think it will have overall?
That's a big question. I think that this is such a big issue, and there are so many people working on it. And I think that's what's so exciting about the field is that there are so many layers that are interested. There's community groups, there's local governments, there's state and federal government, all interested, researchers in all areas. We have, social justice, disparities, epidemiologists, urban planners. Everybody's kind of on board. And so I think with that, we really shouldn't limit ourselves. There's value to really small local studies where you can really understand the community, really get into some of the nuances that I talked about, as well as nuances that I haven't thought about yet, that can inform community groups and local governments in particular, but then big national studies, and also bringing together, kind of having a critical mass of smaller evaluations feeding into the national conversation. There's so much innovation going on as well in terms of community programs, and I think a critical piece of those is that the evaluation piece and really understanding what works and what doesn't, and then feeding that in also into the national conversation. So I know that's not a very clear-cut answer, but I think there's so many players and so much sort of skill and talent from all different fields and perspectives that we can kind of hit this at all different angles.
Well, we've got a bunch more questions. I'm going to try to jump into them and kind of put a couple maybe together. There's a couple that ask the question around defining the neighborhood, and did the team assess any differences by geography or community type, rural, urban, or suburban?
That's something that our group is very interested in. The Cardia study was recruited from mainly metropolitan areas. Birmingham is, of course, less metropolitan than Chicago or Oakland, but we weren't really able to distinguish, pull out enough people that weren't urban. And then the suburban-urban distinction is really, it's not clear-cut. So we definitely think that's an important issue, and we're very interested in it. For the purposes of this particular study, it was going to become too messy to look at that because there are not standard definitions of suburban and urban, and that probably varies according to region and such. But that is a really important issue, and also a next step for us as well as the broader field.
Mm-hmm. Well, there's a couple of questions here that really get at the heart of, I think, why so many people are interested in your study, which is that it says pretty much something different than what many of us had heard in other studies. So we've got two questions in line with that. Do you have any examples of interventions at supermarkets that can or have proven to improve dietary behavior? And have you thought about combining, let me just read this the way that it is. You mentioned that you think the presence of grocery stores is necessary but not sufficient for a healthy diet. Is the necessary component of this something you measured in your own study, or a result of combining your results with the results of other studies that discuss grocery stores as necessary for healthy eating? So I guess both of these questions get at this whole question of, one, the retail access in terms of supermarket access is not being quite the answer, and then what is necessary to increase healthy eating. Did you all get at that at all?
So, I think I'll address the first question first. So why are our results different, and are there interventions out there that show the benefit of supermarkets? So we believe that the reason that our studies' results are different from the previous observational studies, so these other cross-sectional studies that look at similar relationships, it's because we were able to account for a lot of the potential sources of bias involved in cross-sectional studies, because we have this data that followed people over time. When we ran our analysis to be more consistent with a cross-sectional study, so sort of ignoring the longitudinal nature of the data, it actually looked much more consistent with prior research. So it showed, better diet quality with greater availability of supermarkets. But then in our most robust analysis, we got the results that I presented. And the reason I only presented our final results is because they are the most robust. And there also our sort of null findings are also consistent with some of the very few natural experiments that have been done around supermarkets. Only in the UK, though, There were two natural experiments. The first did not have a control, so they just looked at it, what we think of as a food desert. They put in a supermarket and then tracked fruit and vegetable intake, and they actually saw an increase. But there was no control community, and so it could have just been a secular trend. And so they did a similar study with a control group and saw no difference between the two communities. So, comparing the community that received the new supermarket and the one that did not. And so this is our supermarket findings are consistent with the natural experiment work. Clearly, more work around this needs to be done. We need more evaluations and natural experiment research in the U.S., especially in the communities that we're most concerned about. The second question, I'll start to answer it, and then if I don't completely address the question, maybe you can repeat it for me. When I said that the access to healthy food is critical but not sufficient, I really meant access to healthy food and not access to supermarkets or grocery stores or however we want to classify those types of resources. And so and that is based on intuition that if you don't have any, if you can't access healthy foods, you can't really eat healthy foods unless you grow them yourself, I suppose. And so that's where that statement came from, that it's intuitive that you need to be able to buy them, but how you can get through all of those steps between being close to or close enough to healthy foods and actually purchasing and consuming them that's the complicated part that is less clear.
Okay. Well,
So I think that I didn't quite get at the second part of the second question.
Well, I think you indicated it's such a big conversation. I mean, it's a big topic with lots of seemingly moving pieces, and I think it's a topic that we're going to have to revisit at least one more time to really get at what the study means. Because one of the things that was interesting to me that you talked about was that you measured the behaviors of 18 to 30-year-olds. And
at baseline, and then they aged over time.
Mm-hmm. And do you think that has any impact over the period of time that the young people beginning at 18 looking for food or healthy food, do you think that has any impact in terms of where they go and what they might see as accessible options for them?
You mean how their sort of life stage impacts what they... Yeah, I think that's really important. I think in young adulthood is a really complicated time as well. Some people are, having their first jobs, starting families. Others are in college. Others are, they're still living at home. So it's a really complicated and sort of heterogeneous life stage, especially these days. I don't know so much in the 80s.
Okay.
And then, I think that all of these factors really, as you start having, growing a family and the kids get older and, finishing school and, moving along in your career, I think all of those impact diet choices as well as opportunities. So, it's a huge, complicated problem that needs to be looked at in a very thoughtful way.
Okay. Well, in our last seconds here, I want to ask you to tell our audience again where they could find the study if they want to look at it for themselves.
So it's published in the Archives of Internal Medicine. This past year, I believe it was in May. It's volume 171, issue 13. It's not accessible to everybody. It will be within a year, I think. But I think that they can contact me and I can provide a copy. I think that that's allowable.
All right. Jan, thank you so much for your time today. And I'd like to direct all of our listeners to the Healthy Food Action website, which is at healthyfoodaction.org, where you can watch for information about upcoming webinars. And if you're interested in a recording of this webinar, it'll be available within 2 weeks. You can also follow us on Facebook and Twitter, and I'd like to thank everyone for joining us. I apologize for those questions that we just didn't get a chance to get to, and we thank you, though, for your interest, and thank you for participating in the webinar, and until next time, have a great day.